Hey, welcome back to Kinesis PT and Performance. Today I wanted to talk to you guys about cash-based PT. Obviously that's what I do, but I want to explain to you guys why I chose that and how it works. So in a conventional setup between physical therapy clinics and insurance companies, the physical therapy clinic, after treating the patient, sends a bill to the insurance company that contains all of our coding. So whatever interventions we provide for the day, whether it's manual therapy, therapeutic exercise, neuromuscular re-ed, ultrasound, stim, heat, cold, whatever, all that gets sent to the insurance company. Now, if a physical therapy provider is considered in-network, that means they have contracted a negotiated rate with the insurance company. Typically, this is a discounted rate. Not typically, it's always a discounted rate. For example, Blue Cross Blue Shield in Michigan pays about 20% of every dollar billed. So there's incentive for people who have Blue Cross Blue Shield to go to those providers who are in network. Now, don't misunderstand me. This doesn't mean that you're getting an 80% off deal. Obviously, healthcare providers cannot keep a business open and running charging 20 bucks an hour, really collecting 20 bucks an hour for their services. We got too many employees and too much staff. So what ends up happening is these healthcare providers or PT clinics inflate their charges, meaning we bill way more than what we actually need to collect. So a bill at my previous employer for one PT visit would send out to an insurance company for like $400 to $500, and then we would receive somewhere between $110 and $120 back. Again, so we're staying in that 20% range. Now, whatever the insurance company would pay us, that bill gets passed on from the insurance company to the patient at some point down the road. Unfortunately, as the patient, you don't know what that amount's going to be because you do not know what we billed and you do not know what the negotiated rate for reimbursement is in between the physical therapy company and the insurance company. So as a patient, you're kind of getting hit blindside with a bill, and that's something I don't like. For our patients who are considered out of network or don't have insurance, the charges remain inflated and you get smacked with a huge bill when you go see a healthcare professional. So you can see how this is a problem. And this isn't specific to physical therapy. This is systemic throughout our healthcare system. So as a cash-based provider, I say cash-based because it doesn't mean that you cannot use your insurance. It just means we reverse the order of who gets paid when. So in my specific setup, I bill my patients and clients directly. So instead of me billing an insurance company, I bill my patient. My patient pays me the money. I provide my patient with what is called a super bill. A super bill is a receipt that they can essentially upload as a claim to their insurance company. This claim gets applied towards their deductible or is reimbursed to them if their deductible is met. Now, every patient's health insurance plan is going to be different, so you have to check with your agent on what yours specifically covers. But what this allows me to do is work with my patients truly one-on-one for an hour. In a typical PT setup, or most healthcare providers, they have an entire department of people dedicated to specifically just billing and collections with insurance companies. These people spend an entire work week haggling with insurance companies over what codes are billed, what they're supposed to be paid, and when they're supposed to be paid. Sometimes PT clinics, other healthcare providers could be waiting 3 months, 6 months, years trying to collect payment for services they've already provided. That is not what I signed up for. That's not what I went to school for. My job is to be here and help people like you get back to things you enjoy doing, to help you get out of pain, to help you live life. So instead of taking 5 people and having to employ them to haggle with insurance companies and then having to pay them an additional salary, which means I have increased overhead costs, which means I have to crank through more patients through my clinic to pay for these non-revenue producing employees. That's not a great setup. That's the vicious cycle we've gotten into with the healthcare system as a whole. We have so many non-revenue producing employees a part of the system because of the way it's set up. We have to crank patients through to be able to offset those costs to keep the business running. In my setup, because I run such low overhead, I'm able to work with my patients one-on-one for an hour. Now I get asked a lot, is this going to be more expensive for me? How much more is it going to be expensive? That depends. It's going to depend on your health insurance coverage. Everybody's a little bit different. So for example, again, going back to my previous employer, we'd bill out $400 to $500 a visit. We'd collect somewhere between $110 to $120. That's what people were paying a visit, somewhere between $110 to $120 a visit. In my clinic, I bill $120 for the hour. So it's about the same price. However, it's considered an out-of-network rate. So depending on whatever your insurance company is and your specific health insurance plan, it gets applied to your deductible in a different way. So it may be marginally more expensive. However, you're receiving a way better service. If that's not something you value, go ahead. You can go to the run-of-the-mill factory production PT clinics and healthcare providers. But you're going to see a trend starting, well, the trend really has already started amongst healthcare professionals, physicians, PTs, chiros, who just don't want to deal with insurance anymore. They want to be able to provide care to their patients. They want to be able to provide the best care they can to their patients without health insurance companies undermining them. So that's why we run a cash-based practice. Please reach out if you have any questions on the payment setup or how this works more specifically. I'd be happy to talk with you. We're just trying to be a part of the solution, not the problem. Right now, the way things look with renegotiations that go on every couple of years between insurance companies and PT clinics, where the insurance companies want to pay less, PTs need to have their salaries increased just to keep up with cost of living. We have to then inflate charges. It's a vicious cycle between trying to make more money, trying to provide a good service, but you also have to crank through more patients to make ends meet. It's not really something that is sustainable. It's really, it looks like a train headed for tracks that are a dead end. And really the only answer to that problem is to get off the train. And that's what I've chosen to do with my practice. So if you're somebody I can help, please reach out. I'd love to be an asset to you. And as always, please reach out if you have any questions. Thanks for watching. Bye.